Hi, my name is Seth Deja, and I'm a pediatric dentist at Pediatric Dental Specialist of Lafayette. This is my second career. My first career, I was a civil engineer, and after about 5 years or so, I knew that I wanted something different. I looked into different career opportunities, and really, after spending time with others, decided that dentistry was the path that I wanted to go down. During dental school, I had my own young children, and I became more active in their after school activities, soccer, dance, other things. And it was really about that time whenever I decided that I wanted to be a pediatric dentist. One of my favorite things about being a pediatric dentist is showing kids that may be nervous or scared that it can be a really enjoyable experience as long as you take the time and show them and teach them what the appointment is going to be about. Sedation dentistry is a really important part of pediatric dentistry. It's something that we add on. We have multiple options for it, but some of the indications for a patient would be whether, they're just anxious about one appointment, or they've had a negative experience in the past, or we've done several appointments and now they're just having a little bit of trouble getting that last work done. So what we do is kind of assess the situation, speak with the parents, and decide which sedation option would be the most appropriate for each patient. At Pediatric Dental Specialists of Lafayette, we have all the sedation options that someone would need to safely and effectively get their treatment completed. We have laughing gas, which is our nitrous oxide. We have oral sedation, where we have a CRNA, or a nurse anesthetist present. We have IV sedation options, where we have a pediatric anesthesiologist come in, and we also can get work done with general anesthesia in the hospital. The last two options are for patients that might have more extensive work and all the treatment needs to be completed in one visit. However, whatever is needed, we do have a great and effective, safe option for the patient to get the treatment done. At Pediatric Dental Specialists of Lafayette, we realize that everyone needs an individualized plan. So what we do to assess each patient to see what kind of sedation option is, we see how the patient does for their initial visit. We see if they've had any past negative experiences or any anxieties that we're not able to alleviate in the moment. And from there, we can look at the whole spectrum of sedation options that are available and choose the one that's the most appropriate so that the work can get completed safely and effectively, so both the patient and the parents are happy. Pediatric dental sedation is very safe, especially when done in the correct environment. Some of the things that the parents should ask about is who's performing the sedation, what type of sedation we're doing, and what kind of monitoring devices are set up. You really want to have full trust in the facility and the clinician that are doing the treatment and the sedation for your child. This will allow you to have a really good experience and minimize any anxiety that you may have about the procedure. One of the best things to do is ask questions. Ask the dentist, what type of medications are we going to use, making sure that we reviewed their patient's medical history, and what type of monitoring devices may be available during the procedure. So sedation can be the most helpful whenever a patient has either had treatment completed in the past and they've had a negative experience, or we've been successful getting other treatment appointments done, but now that you're getting towards the end, they're just getting a little more uneasy about coming in for those visits. For me, I feel like sedation is a great option so that they can finish their whole treatment and have a good experience and memory and know that it wasn't difficult getting the treatment done. The other option, or the other time where sedation would be the most important, is whenever a young patient has an extensive amount of work, meaning that it would take multiple visits in the office and that it may not be the most comfortable for them to come in and get that work done in 3 to 4 appointments. Then sedation is an option so that their treatment can be completed completely at one time. One of the best ways to make a patient feel calm and comfortable whenever they come into a dental visit is for the doctor and his staff to be calm and comfortable during the dental visit. It all starts whenever the patient first walks in. So we welcome them, we give them a tour, and then we bring them back to the appointment. And there's no rush at all. So we'll show them and tell them what we're going to do. We explain things to them at a level that they can understand, and just give them the time that they need to process everything so that they feel comfortable with everyone in the room and the procedure that's going to be done. If a parent is trying to decide if sedation is the right treatment choice for their child, whether they have decided that from their past experience at an appointment or they've been told, I would say come into our office and let us meet your child and see what work actually needs to be done. And then let us discuss the full spectrum of treatment options that are available. And together, all of us can decide what treatment option may be the best, whether it is with sedation or without. We can come up with an individualized plan so that everyone is happy.